I'm going to give you a very brief overview of the goals of physical therapy, preoperative exercises, how to prepare for your surgery, as well as the length of the therapy process. So what are your goals of rehab during your hospital stay? The first goal is to restore your functional independence, which is why we as physical therapists will be getting you up out of bed either the day of your surgery or the morning after. We will be teaching you, and you will learn how to perform bed mobility, transfers, walking with an assistive device such as a walker, crutches, or a cane, and how to perform or negotiate a flight of stairs. Our goal is that you'll be able to perform all of those independently by the time you leave the hospital. We work to regain your functional strength and regain your joint mobility. And we have you mobilized frequently in the hospital in order to prevent complications of bed rest, such as muscle weakness, blood clots, and pneumonia. Finally, patient education. We will educate you on everything that you need to know in order to safely return home. I would like to take this time to go over some exercises that you will be performing hopefully preoperatively and definitely postoperatively. The first 6 exercises that you see up here will target the major muscle groups of your leg. Okay, I'm going to show you a short video that demonstrates these exercises. Hello, my name is Jaclyn Kito, and I'm one of the inpatient physical therapists here at Greenwich Hospital. Today I will review the pre-op exercises that we recommend you perform in the weeks leading up to your joint replacement surgery. The exercises should be performed 10 repetitions each, 3 to 4 times a day. None of the exercises should cause you pain. However, if an exercise does cause you pain, we recommend that you skip this exercise and move on to the next. If any of the exercises cause you muscle soreness, we advise you to continue as tolerated. The first 6 exercises should be performed while in bed, laying flat or in a semi-flat position while propped up on pillows. Pull your toes towards you and push them away. Pull your toes towards you and push them away. One more time. Push the back of your knees down flat into the bed. Tighten your thighs for 5 seconds. Hold and relax. Push the back of your knees down. Hold the muscle contraction for 5 seconds and relax. Push down. Hold. 2, 3, 4, 5, relax. Squeeze your butt cheeks together like you're holding in gas or a bowel movement. Hold for 5 seconds and relax. Squeeze, 2, 3, 4, 5, and relax. One more time. Squeeze, 2, 3, 4, 5, and relax. Slide your heel up to bend your knee and slide it back down. Slide your heel up to bend your knee and slide it back down. One more time. Push the back of your knee down into the bed, tighten your thigh, bring your leg out to the side and back in. Push the back of your knee down, tighten your thigh, bring your leg out, and back in. One more time. Bend your opposite knee for support. Push the back of your knee down into the bed, tighten your thigh, lift your whole leg off the bed, 6 inches, hold, and slowly lower down. Push the back of your knee down, tighten your thigh, lift your leg up 6 inches, hold, and slowly lower your leg down. One more time. The final pre-op exercise should be performed while sitting in a sturdy chair with arms. Place your hands on the arms of the chair. Lift up using your arms, not your legs, to unweight your bottom. Hold for a second and then slowly lower yourself back down. Lift up using your arms, hold, and slowly lower yourself back down. This concludes the pre-op exercise program. We look forward to seeing you for your physical therapy session after your successful joint replacement surgery. I do have handouts, so if you would like one, please come up and see me after the presentation, and I would love to give you one. Now, if you're having your shoulder replaced, the exercises that you perform after surgery are very minimum. Your surgeon may have you perform pendulum exercises, which are very gentle, and I do have a handout for you for that as well. Now, what should you do to prepare for surgery? We want you to perform your pre-operative exercises that I just reviewed with you. The stronger you are going into surgery, the better your outcomes. Muscles have memory. So if you perform the exercises in the months to weeks to days leading up to your surgery, then they will be easier to perform after, and you will have less pain. We recommend that you perform aerobic exercise, the best mode being walking, for about 15 to 30 minutes, 5 days a week as tolerated. And lastly, as Dr. Ennis had mentioned, try to lose some weight in order to reduce some pressure on both your hip and knee joints. Also, for preparing for surgery, we do recommend that you attend the class that Annie had just spoke about. We also want you to arrange for a recovery coach or a caregiver to help you and assist you in the first 2 weeks after your surgery. This person does not necessarily need to live with you, but they should be able to check on you daily, make sure that you're compliant with your medications, maintaining any precautions or restrictions, as well as performing your home exercise. And finally, purchase equipment. So at the class, you will learn what equipment you will need, but if you're having your hip or your knee replaced, we do require you to purchase a rolling walker and a straight cane before surgery. If you are 5'7" or taller, we recommend that you purchase a commode or a raised toilet seat. And if you're having your hip replaced, we recommend that you purchase a hip kit, which includes adaptive equipment to help you with your activities of daily living. Therapy is a continuum. So the rehab process lasts about 8 to 12 weeks. And during that time, the physical therapist will work with you to continue the goals of normalizing your gait or walking pattern, to reduce your reliance on an assistive device. In fact, sometimes people are walking into surgery using a walker or a cane, and by the time their rehab process is over, they don't need anything. We will increase your range of motion, improve your weight bearing, increase your balance, your strength, your endurance. Our goal is to return you to activities of leisure, of sport that you would like to get back into, and overall improve your quality of life. So I just want to go over the rehabilitation timeline. This is specific for total hip and knee replacement patients. So step 1, after your surgery, you'll spend anywhere from 1 to 3 nights in the hospital. When you leave the hospital, you actually have 3 options for discharge. So option number 1 would be to go straight home and begin outpatient physical therapy for 2 to 3 times a week for 6 to 8 weeks. Option number 2 would be to go home with home physical therapy, meaning a physical therapist will come to your house to work with you for 1 to 2 weeks, and then go to outpatient physical therapy, again, 2 to 3 times a week for 6 to 8 weeks. This is our most popular option. Our third option would be for short-term rehabilitation. So to go to a nursing home where you would stay for 5 to 7 days to receive rehab or physical therapy, and then after your stay, you would go home and immediately begin outpatient physical therapy 2 to 3 times a week for 6 to 8 weeks. If you are planning to have your shoulder replaced, a vast majority of our patients go right home and they don't need services. If you did need services, we would set that up for you. A very small minority of patients will go to a short-term rehab facility, and that's if they are not functionally independent, if they are needing quite a bit of assistance to mobilize and they don't have assistance at home, but majority are going home. So in conclusion, we want you to be an active participant in the recovery process in order to maximize success. As Annie mentioned, it's a team effort, and I want to point out that you guys are a big part of that team. Okay, so you need to put in the effort in order to receive the outcomes. All right, I'll be here if you have more questions or if you'd like to receive one of the handouts.